These are the UK's air ambulances.
17-year-old been hit by a car and is unconscious.
Elite teams taking to the skies at speeds of 190 miles per hour.
Aircraft at Anglia 1 listing.
Got an ETA of 9 minutes.
Specialist pilots, paramedics and doctors
Jack, we're just putting you off to sleep now, OK, buddy?
bring A&E to the roadside
He's got a partial amputation of his forearm.
and countryside.
Life can change in an instant.
Every day is completely unique.
With exclusive access. Our cameras follow 5 teams across the UK.
As we arrive on scene, there's always a little bit of adrenaline.
When you've got severe traumatic injuries, every minute counts.
Racing against the clock.
You must go sideways, do not go forward.
Bringing cutting-edge equipment
Can I have some suction, please?
and surgical skills
Tubes through the cords.
to the most critically ill patients.
Don't leave me, darling.
We've taken over his breathing for him.
You can genuinely make a difference.
I have to pinch myself sometimes that my office is a helicopter.
Always ordered down a helicopter.
There is no catering today, but there is witty banter and drugs to keep you comfortable.
Oh, that's service with a smile.
Coventry Airport, operational base for the Warwickshire and Northamptonshire Air Ambulance. Helimed 53 covers an area of almost 1,700 square miles across the 2 counties.
Coat and hat in the back.
There is a hat and a coat in the back, so
I think mine's left in there.
I'll get my jacket in a second.
Yep.
It's 7 a.m. and the start of the shift for pilot Jamie Pocket, Dr. Ben Taylor and critical care paramedic Pip Gibbs.
I've worked with the Warwickshire and Northamptonshire Ambulance for about 7 years now. I love working alongside this team. I work with some brilliant pilots, paramedics and some other doctor colleagues. I think we provide an excellent service to our local area.
Right, OK, weather today is nice, VFR day, sun's out, good visibility, high clouds, but it'll be quite windy. So southwesterly winds, 10 to 15 knots, gusting 15 to 25 knots throughout the day.
Happy days.
All right, happy? Brief complete. Cool.
The morning briefing is critical to our operations. We'll fly into areas we haven't planned to fly into to respond to emergencies. We need to know what's happening around the patch, we need to know what the weather's like, and we also need to think about and plan to make sure we're as safe as possible when we fly.
Helimed 53. OK, you've got a grid. 492. OK, anyone else going? OK, thank you, bye.
A pensioner has suffered a potentially life-threatening allergic reaction called anaphylactic shock after being stung by a wasp in her garden. Within minutes, severe symptoms can include shock, difficulty breathing, a sudden drop in blood pressure, and possibly cardiac arrest.
Hey.
OK, both engines.
Right.
Fuel pumps and coke.
On.
Captain's lights limiter.
Right, limiter, park brakes on.
You want 140 as your outbound?
140, roger.
The casualty is 21 miles southeast of the airport, 12 minutes away in Helimed 53.
Horizon Helimed 53, lifted well en route to this job. 53, thank you, it's all copied.
What details have you got on the patient so far?
We've got a 70-year-old female who's been stung by a wasp, never had a reaction until now, reported from control having difficulty breathing. They were very worried about what was going on, but it was a little bit unclear, to be honest.
Wasp stings are potentially dangerous for certain individuals because they are allergic to them. Obviously, it's a natural body reaction if you get a foreign substance on board to defend itself to that. Unfortunately, some people's systems overreact and causes systemic problems, and that can be sort of up to full-blown anaphylaxis.
Helimed 53 is still a few miles from the patient's location, and every minute counts as anaphylaxis can develop quickly.
You said there's a crew running, isn't there?
Another ambulance crew is also heading to the incident by road.
Yeah, crew was 15 when I took the phone call.
Fine.
12 o'clock middle distance, you got the village coming
Yep.
into view. Okay, the actual site itself.
Yeah, ambulance, low 1 o'clock.
Big open small field, we've got some low power cables just one field short. We've got the goalpost, so I'll give it a little bit of a steep
and then we'll land in the middle of the football field.
Yep. Okay. Gear down. Okay, you over the trees.
Roger. Cool. We are committed.
You're clear left behind.
Roger. Hold it nicely. Brakes on. Okay, clear doors. Clear doors, standing out.
That way.
Yeah, seen. This one's the green door.
Hello? Ambulance.
Hello there, how are we doing?
Hello.
Oh, better than you guys were here.
Right, hello there, how are you doing?
To come in.
I'm Ben.
Penny, a retired teacher, is already suffering itching and swelling and is having difficulty breathing.
Were you out gardening, I'm guessing?
I was playing with the sausage.
Oh, okay.
First thoughts on walking in and seeing Penny, although she was talking to us, she was very pale and she was very sweaty.
All right, so the wasp thing was on this hand round here.
Yep.
Occurred about 40 minutes ago.
Oh.
She's just come across very faint, very dizzy. Been brought in here and just sat down. She is now saying her chest is feeling a little tight.
It was clear she was having a full-blown anaphylactic reaction to the sting.
Numbers all okay in the monitor?
We're just a bit hypotensive.
The adrenaline will help with that.
Yep.
Anaphylactic shock can kill very easy and it can kill quickly. The body's immune system goes into overdrive and you lose fluids, you lose blood pressure, and you often lose consciousness.
Oh God, I can't believe this.
All right.
So you can't believe this?
No.
No.
Penny is given an injection of adrenaline directly into muscle to try and reverse the effects of anaphylaxis.
Oh.
Adrenaline is your fight or flight hormone that your body naturally produces. It makes your heart pump harder and it makes your blood vessels squeeze to bring your blood pressure up. Penny's body is producing her own adrenaline, however, it's not enough in her case.
Oh.
Sorry, Penny, we're attacking you from all sides.
Oh.
We're just getting another cannula in for you there now.
Nice and still if you can.
If we don't treat Penny quickly, then this reaction will continue to escalate.
Right.
Right, I'm happy that's in. If we've got the fluid, I can put it straight on.
Great.
And that will then lead to swelling of the tissues, especially swelling around the throat, the tongue, the lips, and this can lead to blocking the airway off completely.
Work anyway.
Hydrocortisone dose.
Is 200 usually.
200, yeah. Yeah, you'll start to feel a bit better soon, hopefully. There you go.
Oh.
I have 200 milligrams of hydrocortisone. It's fine.
The adrenaline gets on top of the initial problem. However, if we leave her be, the reaction's going to continue to burn away. Giving her steroids and antihistamines will help her fight that and counteract that over coming hours.
Hydrocortisone, 200.
200 hydrocortisone.
200 milligrams.
Okay, so we'll give that a bit gently because we're nearly through with the first 250 of fluid. Okay, Penny, what we're giving you now is steroids, okay? It helps with allergic reactions. You have to give it a little bit gently. You're starting to feel a little bit better.
Oh God.
But before the drugs can take effect, Penny takes a turn for the worse.
What it's done is caused your blood pressure to go very, very low, and that's what is partly what causes you to sweat like mad and feel really woozy-headed and feel pretty rubbish, to be honest. As that recovers, hopefully you'll start to feel a little bit better.
Bananas and raspberries.
What the socks do?
15075.
Oh, okay. Oh, good.
Penny's actually now stabilising and doing quite well. Blood pressure, although it was a bit slow to react to start with, it's coming up nicely now.
Love when the plan comes together.
Yeah. It's amazing, isn't it? Just that little bump.
Little tiny, yeah.
I can't believe it. Oh, and the sweat.
Yeah.
Jeez.
So we've got a decent window of relative stability here while the adrenaline's working.
Oh,
Shall we move towards the amble, do you think?
We'll pop that back on for a minute. Might make you feel a little bit better. That's just oxygen, okay? It's not a bit of nice fresh air.
No longer in a life-threatening condition, Penny can now be moved safely to the land ambulance.
You want to hold on to me as we do this? You ready?
Yeah.
1, 2, 3.
Can I just relax down there? Fantastic.
As she's prepped for the 12-mile drive to Horton General Hospital in Banbury, Ben updates her husband.
So what things happen, sir? I think your wife's had an allergic reaction to the wasp sting.
Yeah.
That's a severe allergic reaction that's caused her whole body to have what we call an anaphylactic response.
Yeah.
So she's on the right treatment. She's responding pretty well to that, actually, so I'm reasonably happy with how things are going now. So
good.
Fingers crossed.
Right, so we stick ECG on and do a BM.
And when they get there, I mean, they're likely to keep her in overnight, or?
They'll keep her in for a wee while. They'll need to monitor, because sometimes allergic reactions recur once the medicines wear off.
Yeah.
So they'll keep her in for a while.
Okay.
Okay.
Thank you for all your help.
With Penny stable, Pip and Ben leave her with the land ambulance to transport her to hospital.
All right, they're happy. Right. Shall we? Yes, we're off now. See you in a bit.
Okay,
Yes, sir.
bye.
Penny's now out of immediate danger with the initial treatment. However, once your body's reacted badly to something like this, your body is primed to react badly to it again. So she's at risk of further severe reactions if she ever gets stung by a wasp again.
Okay, gonna pick up. Phil's gonna come to the left slightly.
Okay, that one large tree about 10 o'clock.
Happy. A vertical climb out of here.
Nobody expects to meet us when they step out of the door in the morning to cross the road or walk to the shops or do a bit of gardening, and we hope we can make a difference to things. Life can change in an instant.
Closing control, element 53, now lifted from scene, routed back to Coventry. We are available. Meet you about base 7 minutes away.
It's 25 years since Essex and Hert's air ambulance started up. Almost 30,000 missions later, it's still delivering vital critical emergency care to over 3 million people in the southeast. As well as HeliMed 55, the charity has a fleet of critical care response vehicles stocked with advanced life-saving drugs and kit.
Right, we are on S05E07.
Yep.
Tyre condition.
I've already had a preliminary look, they're all good.
I'll just check around the back of these. There was a nail hiding around the back the other day.
Today's medical team are Dr. Rachel Harding and critical care paramedic Scott McIlwain.
So we use rapid response vehicles, or RRVs as they're known to us, for a number of reasons. When the aircraft is offline for maintenance, whether they be scheduled or unscheduled, we can't fly in bad weather, and also we don't fly at night. Big red.
And that has a defib I've put in and a suction unit in the front. Cool, and then we can book online.
Yes, I think.
The team have to be prepared for anything, but the most frequent types of incidents are road traffic collisions, cardiac arrests, and accidental injury.
Hello, we've got Jockey Hartford, please. A 14-year-old male, fractured leg, sounds like stigma.
Okay.
Hey, Scott, wasn't sure if you're upstairs. We've got a job in Hertford, over.
The incident is a 20-minute drive away, just 16 miles northwest of base.
I've got your leg bag.
It's in the back, where my jackets and stuff. So.
Echo Alpha Medic 55, over.
Medic 55, pass the message.
Okay, we're mobile at 24 and our ETA is 11:50. That's 11:50, over.
I think for any clinician responding to an incident involving a child, it certainly heightens your awareness and attention, maybe. And being a father myself, you kind of have an extra understanding and maybe some more empathy towards the situation.
55, go ahead.
55, can we just make you aware that you don't have any backup? If you've just gone past another ambulance that's actually going on to another job.
Yeah, that's all received. We'll give you an update on scene. We're less than 5 minutes away, over.
Thank you.
So we can get to the patient in the RRV and we can start the care, but the patient still needs to get to the hospital. And unfortunately, our aircraft's offline, so therefore we need backup from the ambulance service.
Oh, there you go. This looks like something.
Yeah, this looks like it. Just here on your left, look, I think.
Oh, they're waving there, straight ahead.
Ah, right, OK. Left park.
I'm Connor's dad.
Hello there.
Just over, off-duty fireman.
Oh, excellent. I'm Scott, this is Rachel.
How you doing? All right?
How are you doing?
So I've checked him out best I can. He's complaining that he's got a lot of pain in his femur at the top.
Yeah.
He's been conscious all the time. That is his main pain. He says he can wiggle his toes. think the hardest bit is getting him out of the bowl without pain.
Yeah.
Do you want me to bring one over, or...?
Yeah, go on then, you can take that one if you want. Did you say you were Connor's dad?
Yeah, I'm Connor's dad.
We arrive at the scene and Connor's dad is remarkably calm. He tells us exactly what's happened and it's really helpful. His background as a firefighter definitely helped in the situation.
Connor was practicing tricks and jumps on his bike with his friends when the accident happened, and he fell into the steep-sided skate bowl.
Yeah, it's going to be tricky, this, isn't it?
Do you want to pass?
Right, I'm going to elegantly come down the slope.
Can I pass this one down the slope?
Yeah, of course you can.
Okay, it's quite heavy.
Hello, is it Connor? Connor, my name's Rachel. I'm one of the doctors with the air ambulance. And I've got my friend Scott with me as well, OK? Do you remember what happened?
I dropped in and slipped and my leg, like, stuck out to the left.
Yeah.
And it just, like, went sideways.
Just went sideways. And you were on a skateboard or a bike? Bike, fine. All right, what we're going to do, I'm just going to uncover you a second and we're going to have a good look at you. And while I do that, Scott's going to start just cutting your trousers off, if that's OK. And then we'll work out how to get you out of...
it just feels like my leg's gone dead.
Yeah. Did you feel a crack or anything?
No, I just wanted to lay down.
Yeah, that's fair enough. Whereabouts is it hurting exactly?
Oh, like right in this area all the way around.
Yeah. OK. What I'm going to do, Connor, if it's all right with you, I'm going to get our monitor on, because that means we can give you some strong painkillers. Yeah. And then what we need to do is get some backup so we can get a longboard or a scoop to get you out of the bowl. Yeah? All right, buddy.
So whilst we're treating Connor, I'm also thinking about how we're going to get him out. I've experienced this before and I know it's not easy. You know, a young lad with a broken femur, we're going to need more hands.
From an extrication perspective, do you think we need any additional extrication support? I mean, you're nice and light, which is a start.
Yeah, I think a scoop should be right there. I think. Yeah, there's plenty of people around.
The femur, or thigh bone, is the largest and strongest bone in the body and requires a great deal of force to break it.
It hurts.
Right, let's get this drip in and then we'll get you covered up because I know you're going to get cold.
Rachel's priority is to get a cannula into Connor's arm so drugs can be administered quickly to ease his pain.
The shaking's making it hurt more.
Is it? Oh, bless you.
As Rachel carries on treating Connor,
Right, you stay nice and still for me, just stick that down.
Scott radios control to get an update on backup.
Yeah, 5-5, obviously with patient. We believe at this time just an isolated left femur fracture. Do we have an update on resources?
Still nothing assigned as yet.
Okay. Do you know how far down the stack we are?
There's definitely an older C2 outstanding in Hartford than your one.
And any other air assets, just out of interest?
It would be Cambridge, and they're going up to Colchester at the minute.
All right, we'll get back to you. If you could just update us when there's a vehicle available, that'd be brilliant.
A C2 is a Category 2 emergency call for chest pain and heart attack, which requires immediate priority.
So he's second in the stack, but that's at C2. So all we can do is make comfortable sit and wait.
Yeah.
Or we look at getting an air asset.
But obviously, we don't know what will happen in the meantime. So what we're going to do, we're going to draw up some painkillers to give you through this drip, OK? And we're still waiting for an ambulance to be assigned to us, because unfortunately, they're super busy at the moment. As soon as we've got an ambulance here, we can give you some even stronger painkillers if we need to, like some sedatives, to get you rolled onto your back and comfy, OK? But there's no point in moving you twice, because I don't want to hurt you twice, all right?
It's always difficult when we don't know how long backup's going to be. Connor was being really brave, but he was quite quiet and clearly in quite a lot of pain, so we start giving him some morphine to try and get on top of it. And then we plan to use ketamine once we're ready to move him to make sure he's sedated and doesn't remember the pain during moving.
Agreed.
With a cannula fitted, the morphine will be administered directly into Connor's bloodstream, rapidly relieving pain and lasting for several hours.
Right, so this is morphine, so this is the good stuff, all right? This is going to make you feel a little bit more comfortable, and it can make you feel a bit funny as well, but funny in a good way.
With any broken bone in the leg, there's a possibility that either the nerves or the blood vessels could be injured as well, so we always check the circulation and the ability of patients to feel and move their feet, just in case we need to pull it into a better position sooner rather than later.
Can you lift this leg up at all?
I've already tried. I can do it like, just like, if I try really hard, then about a centimetre.
Try as hard as you can. Let's have a look. All right, darling, don't worry. Can you wiggle your toes for me? And can you feel me touching your foot? Yeah. Fine.
With Connor stable and his pain carefully monitored, an update comes in from control.
Go ahead.
Just let you know, ETA for Anglia 2, 1234, and police have been requested.
You're a star. Thanks, Mehdi.
In the absence of any available land ambulances, Anglia 2, one of neighbouring East Anglian Air Ambulance's helicopters, is now free and on its way to assist.
You might be. Yeah.
Will, happy?
Yeah,
All
yeah.
his numbers are good.
Yeah.
Nothing's changed.
I'll just keep giving a milligram of morphine every 5-10 minutes
Brilliant.
as we go.
Right, let's get this done.
There we go.
Backup has finally arrived, along with 2 police officers to help clear a safe landing area in the busy park.
Yeah, can we just stop them walking down the path would be great. Yeah. Ideally, I want to get them as close as I can here, so. We all good? So aircraft when they're landing can produce a significant downwash. As we have the police with us on this occasion, they're able to clear an area to make it safe for the air ambulance to land.
Connor's now been on the floor for quite a long time, so seeing the helicopter arrive gives us a real sense of relief that we're going to be able to get him out soon.
Yeah, it feels like it, doesn't it? It's amazing what we do for the kids, eh? Hiya.
I'm Rachel, this is Scott. So down here we've got Connor. Connor is 14 years old and this is Dad that's with him. Examining him top to toe, but he has severe pain and tenderness in this distal femur on that left side. Okay. It is slightly swollen, but it's not hugely deformed or swollen. The easiest way in is here.
I was going to say, yeah.
Right, Connor, the cavalry have arrived.
The team are using a stretcher with multiple handles, which allows more people to help with the extrication and gives the best chance of getting Connor safely out of the steep-sided bowl.
I think what we'll do is we'll get some ketamine in and then we'll roll him back onto the scoop. It's an isolated leg injury. Once we've done that, we'll wrap him nice one because he's freezing. And then we'll have a little look at him.
Ketamine will sedate Connor so he can be lifted onto the stretcher and out of the bowl.
So, extrication.
Interesting.
Yeah, I was thinking originally that we rest him on there, get some people up top, and maybe even just a drag and then a lift.
Half, so
yeah.
One bit up there.
Yeah, I don't think there's an easy way.
When another team arrives, it's always really important to have a clear moment of handover so that one team is in control, which then also frees us up to be able to respond to other taskings if needed.
Just boss us around however you want.
With the extrication plan in place, the team prepare Connor.
The Kendra traction device is a device we use on people that have a broken femur. The idea is that it keeps the femur in the right place and, if needed, can pull it out to the right length.
It's about 1 inch taller than me, so I'll measure it on me.
The straps keep Connor's legs together to prevent any further injury or pain.
Right, happy with that?
Good.
Okay, ready, steady, move. Oh, well done, Connor. Lovely. Excellent.
There we go.
Hello, young man.
Hello. Well,
Yeah, please.
While the pole will provide support and help realign his broken femur.
Do you want one more less? We're kind of between. I just thought when we put.
Blanket the right way
I think it's probably about right, isn't it? I just thought once it had gone up, I think it's gonna.
All right. I think I'm waking up.
that's okay.
I think you are too.
Thank you so much. I can straighten it out a little bit.
Heavily sedated and secured in the scoop, Connor is transferred onto the stretcher to keep him secure during the difficult extrication.
I'll get out of the way because I'm not very helpful in these situations.
This has been quite an ordeal for Connor and for his dad, so there is certainly a sense of relief that once we get him out of the skate bowl, that his journey can continue to the hospital. Come up. Oh, thank you, Connor, for being light. Connor's not a heavy chap, which is fortunate for us, but regardless of the patient's weight, we will always have as many hands as possible to make it a safe move out of the bowl and onto the trolley.
Very much.
No worries, all the best. I'm sure we'll be fine, yeah.
Hopefully I'll drive over.
Yeah.
Although Connor's injury is fairly serious and he's likely to need an operation, he's a kid, so they tend to heal really fast, and I'm sure he'll be back on his bike in no time at all.
Lister Hospital in Stevenage is a 9-minute flight away where Connor will be assessed further and x-rays will be taken to determine if he requires surgery. North Weald Airfield in Epping, Essex, home to the Essex and Herts Air Ambulance and Helimed 55.
Right, happy. It's got cardiac and a linear probe. It's got a battery. The data's set correctly. 4 sachets of lube and sandy cloths.
Cool. This is one of the 2 helicopters the charity uses to provide emergency medical care 7 days a week.
Helicopters are packed the same way every single day without fail. And the reason for this is that no matter who comes on shift, whatever doctor or paramedic, if they need a piece of life-saving kit at a moment's notice, they know exactly where it's going to be and can have full confidence that it's going to be there.
Okay, it was very quiet yesterday, so I'm not stressed or tired at all, and I stayed in a hotel, so I slept well.
It's the start of the weekend shift for critical care paramedic Chris Eagle and Dr. Roger Bloomer.
Synchronised time. So the time sponsored by my watch is 19.
19, yeah. 19, yeah. The team synchronise watches to ensure all timings are correct when treating a patient.
Start of each day is regimented. There are processes and procedures that we have to go through to ensure that everything is done safely and we are prepared for any eventuality and any job that may come on that phone.
Helimed 55.
I've got a call for you, Little Claxton, please.
Little Clacton, yeah.
41-year-old with burns to the abdomen.
Okay, I'll give you a call once we lift you with an ETA.
Right, mate.
Thank you.
The incident is 43 miles northeast of the base, where a man has been badly burned while having a bonfire in a garden. Today's pilots are Sam Tompkins and co-pilot Ollie David.
Burns, by their very nature, they're nasty, nasty injuries. Even the most simple of burns are extremely painful. And so my first thought is about how we can look after that patient. How am I going to be able to make that patient comfortable? And what am I going to have to do in order to make that happen? Burns are medically complex in what it does to the body, not just the burn that you can see, but what it does afterwards. The interventions that we need to do need to be done very quickly.
With a top cruising speed of 190 miles per hour, the aim is to reach any incident on their patch within 20 minutes.
Cheers, mate.
Each year, around 250,000 people suffer burn injuries, with many caused by accidents at home. A land ambulance crew has already arrived and is treating Nigel in the bathroom.
You see the fire still burning in the back garden?
Was it that back garden?
Yeah, yeah. How you doing? Hiya, how you doing? I'm Roger, this is Chris. Hi, Nigel.
Basically, out in the garden.
I saw the fire.
Yeah, that's blown back
Okay.
and hit him. He had flame retardant trousers that had holes in. Caught fire, he dropped, rolled, came in here. Burns there and on that leg.
Okay, well,
I had checked. I have been pouring water on, we started shivering, getting
Okay.
cold, temperature 36.
Fine. How long have we carried on? How long have we been
We've had about 10 minutes so far of water. I've just been letting the shivering stop.
So the usual course for treatment in burns is what we call active cooling. So that's up to 20 minutes of cooling of that burn with kind of tepid water. Obviously, your natural go-to would be to go very, very cold water. But what happens with burns is when we actively cool a patient for 20 minutes, even a grown adult, that patient can become hypothermic.
I had my work clothes on.
Right.
My petrol on it. Wind blew the flame.
Okay. What's your job?
I'm a gardener.
You're a gardener. And so the clothing all caught fire, dropped and rolled.
Yeah.
That put everything out altogether?
No, it carried on.
Carried on?
I patted it out and it, eventually went out.
Right.
It's easy to get distracted by the initial images of the burns. What's important for us is to understand the knock-on effects of the burn, the loss of fluid from the body and loss of blood volume from continued fluid loss through the damaged skin. The risks of infection and potentially sepsis do occur.
So burns to the tummy and to the thighs?
To the thigh. I have
Just
checked-
that right thigh, nothing on the left that you can say. We'll have a look in a moment, okay?
And I've also checked and there's no burns to the groin area.
Fine. We'll get some of this pain relief in and then we'll carry on with a bit more with the cooling going. And obs have been all fine with yourself while you've been here?
As is on there,
Yeah.
temperature 36.
Let's stick out around you.
The adrenaline's obviously kicked in with Nigel. He's trembling uncontrollably, and that's often a sign of excess adrenaline circulation in the body as a result of the pain, the anxiety, and the burn process itself.
You all right? Is that just shivering with cold, do you think, and the adrenaline? Bit of both. One of the key assessments that we need to make is the total body surface area that's involved in the burn. For smaller burns, we can use the patient's palm of their hand, roughly as 1% of the body surface area. Right, so we're looking at... Pop your hand up for me to see what size. Well, not too far off mine. 1, 2, 5, 6, 7% roughly. Okay. Fortunately, Nigel's burn is relatively small. Fine, you've got a cannula in. You don't need to start any fluids. He's below 10%. You want to carry on there just for a moment? Yeah.
Yeah, we need something. The old shower's just pumping out hot.
Yeah.
With the shower broken, Chris is improvising with a continual supply of pots and pans filled with water.
Take your head back, all right? Sorry, mate. Sorry, buddy. Well done, mate. Doing really well. How's that pain relief? Has it helped at all?
A little bit, yeah.
Yeah?
That's more.
Are you better with it being that temperature?
Good man, good man. Now, your body temperature is okay. What we really need to do is try and take some of the heat out of that burn. So we need to try with a bit more water. I can try and make the water a little warmer, and by warmer I mean not ice cold. Because what happens is whilst there's no more heat source on it, that skin inside is still burning. So we just need to slow that down. Here we go.
As the local ambulance crew continue to try and cool Nigel's burns,
All right, mate.
Chris updates control.
Echo Alpha, Helimed 55, just an update from the scene. Patient's got burns, mainly superficial, across his stomach, and at this point it's going to be triaged to a local. We'll update you as to whether we've seen assist or ground escort. So what we're doing, we're just deciding which hospital is best to take you to. We'll pat you dry on the bits that aren't burnt, and then we're going to pop some cling film over the top of it. I know it sounds silly, but what's happened, because you've taken the top layer of skin off, you've exposed all the nerve endings. So if we cover that back up, hopefully that's going to give you a fair amount of pain relief. Does that sound like a good plan?
Yeah.
Yeah? All right, perfect. So we're going to step out onto here. All right, buddy?
So take this off.
Just watch you don't slip, nice and steady. Good man.
When air or clothes or anything else rubs across any exposed nerve endings, that's going to cause Nigel pain. So by putting cling film on there, we eliminate that.
Right. Well done, mate. That's it. Park your bum right in that corner. Watch you don't scrunch yourself up in the middle, it's going to hurt.
Have you dealt with your legs?
Secondly, it's a barrier. It stops any kind of transmission of dirt or infection into the wound.
It'll sting for a moment and then...
And thirdly, in comparison with other dressings, it won't stick in the same way. It's simple, it's effective, and it's very, very safe.
Did you get on all right with this gas?
Yeah.
A bit more?
Crack on. Corner, perfect.
Does that feel a bit easier, Nigel? Now you've got...
On your left arm?
Get them loaded on. And...
Right.
I'm happy that his burns have been effectively cooled and that his pain management is in process. I'm also happy that Nigel doesn't need to go to a specialist burn centre at this stage, so there's no need for us to transport him to hospital by helicopter.
The land team will take Nigel to Colchester Hospital.
Once Nigel's in hospital, he'll be reassessed and his injuries will be discussed with the burn centre for ongoing advice.
Thanks ever so much. Take care, all right? Nice to meet you.
Thanks very much, thanks. All right, cheers, thanks.
Echo Alpha, Helimed 55. Just an update, mate. The crew will be taking him to Colchester. We are just going to make our way back to the aircraft, but we are pretty much clear from scene if you've got anything else waiting.
RAF Benson in South Oxfordshire, home to the Thames Valley Air Ambulance and Helimed 24. With an average of 7 call-outs a day, the charity provides critical emergency care across Berkshire, Buckinghamshire and Oxfordshire. On duty today are Dr. Stuart McMorran, critical care paramedic Matt Hale and pilot Alf Gasparo.
An air ambulance crew consists of a critical care paramedic and a critical care doctor, and what we do is we bring the hospital essentially to the roadside.
Parking Blueberry.
2-4, thank you. Go ahead with grid over.
Sierra uniform 556
835.
Sierra uniform 556835 Blueberry. Go ahead with details.
It's the team's third call-out of the day to an accident 7 miles south of the airfield.
Yeah, good, thanks. Security bars go from left, and we're going to ramp briefing.
It should take the twin-engine Helimed 24 with a top speed of 160 miles an hour just 5 minutes to get there.
This is a motocross incident, multiple injuries. That's what we know, Stu.
This is not the first time the team has been called out to a motocross accident.
We're quite frequently tasked with these incidents as patients get some quite nasty injuries despite people wearing protective equipment. And you can have injuries from simple ankle injuries to serious pelvis, chest or head injuries, and it can be potentially life-threatening.
2-4, thank you. Our ETA to the overhead is 3 minutes. Over.
Further information, got updated fractured femur and a query dislocated hip. Over.
2-4, thank you. That's all received.
In Oxfordshire, Dr. Stuart McMorran and critical care paramedic Matt Hale from Thames Valley Air Ambulance are heading to an injured motocross rider.
The patient has a potential dislocated hip or a fractured femur, or maybe both. Predominant issue is the amount of pain that the patient could be in, but there's also issues around bleeding, nerve damage, or long-term inabilities to heal.
There's a crew on scene. Hopefully it might make it a little easier to spot where they are. All depends which end they're at, doesn't it, really? Well,
Okay, the ambulance is right here.
Yeah.
Okay, landing chase, we're going to land in that field.
Often the air ambulance will attend in addition to the ambulance crew to support our colleagues, and in doing so we bring a specialist paramedic and a doctor to the scene so we can deliver advanced medications and pain relief.
Good to go.
On arrival, the patient has already been transferred from the racetrack to the ambulance.
Right. Long deep breaths, Carl. What's happening?
Hello. So this is Carl. Carl was on his motorbike. He's gone over a jump, and then the nose of the motorbike has gone into the dirt because he's gone over too fast. And then he's swerved and gone into the bank. Looks like he's got a mid-shaft femur on his left-hand side. Yep. The area around the hip as well is a little bit deformed, so we're not sure if we're looking at a dislocated hip as well, although it's not difficult to tell.
It's very apparent that Carl was in a lot of pain. We had to be cautious not to get distracted by that and make sure we didn't miss any other injuries.
He had 20 milligrams of oral morphine. It was more pain relief than anything else really.
Hello, my name's what's bothering you the most? Is it your leg?
Wait, like your hip. It's mainly my hip.
Okay, all right, let's have a quick look at you. I'll just get some pain relief behind you.
A hip dislocation is where the hip comes out of its socket. The problems with this, apart from the pain, is that it can cause significant damage to blood vessels, nerves, tissues, muscles and tendons as well.
Carl, I'm going to press this down on your leg. Any pain that I push down here?
A little bit as you go to the top.
Anything down here?
Hurting my hip.
Hurting your hip, okay. We'll get you some good pain relief, don't worry. So, not obviously, but there is a bruise on the inside there. Anything down this side, buddy? No. That's all right. You feel me touching your toes?
When I examined Carl's femur, I was able to see there wasn't any swelling, there was no obvious deformity, and when I pressed down, feeling the bone on his leg, there was no obvious tenderness.
So the femur looks all right, doesn't it? Yeah, so the pain is only up in his hip when I press on there, so I think it's probably just hip.
Up towards his hip, it was apparent there was obvious deformity there. His leg was rotated internally, indicating that it could potentially be a dislocation.
To ease Carl's pain and prevent further damage, his leg needs to be straightened back in line with his hip joint.
So, shall we do some sedation, get a leg
work out exactly what's going on,
and then we'll need to then have a conveyance plan. But flying is going to be difficult with him like this.
They're not got any easy. Okay, Carl. This is our plan. So you've damaged your hip, obviously. What we're effectively going to do is sedate you, just so we can get this sorted, because as we straighten your leg, it's going to be too painful otherwise. Is that okay? I mean, as long as we get in a better position, then we can see a bit better what's going on.
You're right, let's take a long one.
Okay, Carl, we're just getting you prepped, and we're going to get you some good painkillers, mate. Just bear with us a few seconds, we're going to get you sorted, all right?
Carl, I'm just going to give you some pain relief first, all right?
All right, so
We're going to give you some nice strong medications called ketamine. It will essentially sedate you enough that we can get your leg into a straighter position. And then it will need to be sorted properly at the hospital, all right? And you have an X-ray and find out what's actually going on. Do you have any questions? Happy? We'll get sorted as quickly as we can, all right?
Before putting Carl's leg in traction, Matt needs to work out how much ketamine to administer based on his weight.
Carl, right. Silly question, mate. Do you know how much you weigh?
About 100 kilo.
100 kilos, okay. Sure.
When we give Carl ketamine, we need to make sure that we give him exactly the right amount. If we give him too little, he'll still be in a lot of pain. Too much, we could essentially anaesthetise him.
Drug dose is confirmed, so based on 100 kilos, my plan is to start with 50 milligrams ketamine, 0.5 and up to 100 as necessary.
Ketamine is a powerful anaesthetic which will block signals from Carl's spinal cord to the part of his brain associated with pain.
Yeah. Okay, so the plan is, guys, we're going to do a procedural sedation to get this leg straighter and in position, and then probably have to maintain some form of sedation on the way to hospital to make sure we're comfy. Any airway emergencies, we'll just stop and, yeah, that's fine, mate, and I'll make it very clear we have an airway issue. Okay, Carl, so what I need you to do is think of somewhere you'd much rather be that's not here, perhaps on a beach somewhere else. Think, okay, having a nice beer or whatever's your tipple. Yeah. And then I'll get you a lot more comfortable. Make some people feel a bit woozy, just relax into it, okay? All right, what I want you to do is try and keep your eyes open for me. How are you feeling, Carl?
Oh, my God.
Still very tense.
Oh.
Happy number 20.
Oh. Oh.
How are you feeling, Carl?
Fucking hell.
Ketamine is a strong dissociative anaesthetic drug, and what it does to Carl is that it switches his brain off from realising what's happening as we're applying the splint. So despite him looking like he's in pain, his brain doesn't know that.
Still no loss of verbal contact. So.
No, you can keep going.
Oh,
where's his head?
It's okay, just relax, buddy. You're doing absolutely fine.
Now that Carl has been sedated, Matt and Stuart turn their attention to straightening his leg, ready for transportation.
Yeah. Pulse.
Right, I'm going to come down and just put some gentle traction if you're happy to put the splint on. Just relax for me. If you want to put the big hitch on.
Try and relax, Carl.
Nice and relaxed, buddy.
Let's not get caught up.
Stop, Carl.
The traction splint will keep Carl's legs still, preventing muscle spasms and further damage to any surrounding soft tissue.
We're happy. Cool. Okay, sure. So shall we, while we're relatively safe, should we get seatbelts on, blanket on, and then just start moving? So what's your plan? We'll give him some ketamine maintenance on the way. Or... Cool. Right. Be ready to make some tracks, I think. Thanks, buddy.
Yeah.
All right, we're just going to take you to hospital. Just relax, my friend. You're doing well.
Oh, my God. All right, it's going to get a little bit bumpy for a while.
Obviously, we'll get real steady on the way out.
Yeah, gentle as I can.
Yeah, I know it's a pretty awful road, isn't it? So, see what you can do, buddy.
Now Carl's comfortable. Rather than risk moving him into the helicopter, Stuart and Matt will stay with him as he travels by road to the John Radcliffe Hospital in Oxford.
Just close your eyes, my friend. Just have a little bit of a sleep. We've got a little bit of a journey in the ambulance first.
So despite sustaining quite a painful injury, Carl's been extremely lucky that he hasn't damaged any other of his vital organs. We are really hopeful that if this is just a dislocated hip, then once put back into place, probably in theatre, Carl will make a full recovery.
We're at the end of the track now, Carl, so it'll get a bit smoother now.
I was scared, but I just knew I had to stay calm. I asked my friend to bring my phone over and then just dialed 999 and described my injury. My dad's always taught me to be calm around injuries because panicking doesn't make it any better.
I was really proud of Connor that morning. Being a firefighter, you're used to going to traumatic accidents, but when it's one of your own, it is a little bit different dealing with it. Fortunately, I've always said to Connor, stay calm and see if you need any medical assistance. I think it worked on a day, yeah.
2 days later, Connor went into theatre.
I had an operation on my femur where I had a metal rod through the middle and I had screws on each end of it.
Connor's back on his bike. As soon as his doctors said he was OK to get back on there, I think he was back on there that afternoon, wasn't you?
Yeah.
His progression has come on leaps and bounds.
I'm doing bigger jumps, as big as I can get, and as many tricks as I can learn.
And if he's enjoying it, you know, sometimes you've got to take that risk in life, haven't you?
Connor does need further surgery soon to remove the rod.
Yeah, we've got another operation to come yet, but I'm sure we'll pull through it really well.
I didn't know a lot about the air ambulance, but I know that it's donations funded sort of thing. I'm very grateful that they were an option to come and help me, and I'm very grateful for what they did for me.